Good morning, everyone. I am Dr. Vijeta, and today we'll continue our discussion on unexplained infertility from Eshre 2023 article. And in the last, we will discuss the difference between the unexplained infertility given in Eshre 2023 and ASRM 2020. As we have discussed in the previous video made by me on unexplained infertility defined by Eshre 2023, which include apparently normal ovarian function, fallopian tube, uterus, cervix and pelvis, age less than or equal to 40 years, adequate coital frequency, apparently normal testicular function, genitourinary anatomy and normal ejaculate. So this is the definition given by Eshre 2023, and we have discussed how will you evaluate the ovarian function, the fallopian tube function, uterus, cervix, and the pelvis, and also we have discussed about the adequate coital frequency. In the today lecture, we will discuss about the normal testicular function, genitourinary anatomy, and normal ejaculate. As we have discussed in the definition of unexplained infertility, male genitourinary anatomy should be normal before calling a couple as unexplained infertility. Let's discuss how will we evaluate male genitourinary anatomy. So the starting point of any infertility evaluation starts with history and examination. And in case of male, if the history and examination are normal, then and also the semen analysis will perform in the first visit. If both three are normal, then their role of imaging is not much. That is, testicular imaging is not recommended when the semen analysis according to the WHO criteria is normal. Why this is? This is due to the fact that there is no additional benefit on performing the scrotal color dot ultrasound if the normal semen parameter is there and physical examination is absolutely normal. That's why the recommendation is made like this. As we know that semen analysis should be done, and if it is normal, then we call the couple as unexplained infertility apart from the other criteria. So the semen analysis should be according to the WHO criteria and performed by a lab which subscribe to an external quality control program. And also, if the criteria for semen analysis is below 5th centile, according to the WHO criteria 6th edition, then we have to perform it again after a 3-month interval. This is according to the Eshre 2023 guideline. Let's discuss recommendation as per Eshre 2023 for other male additional tests. So anti-sperm antibody. Anti-sperm antibody testing is not recommended when the semen analysis is normal, as there is no sufficient evidence that it will be benefit if the semen analysis is normal. The second is DNA fragmentation. Sperm DNA fragmentation test is also not recommended if the semen analysis is normal. Also, there is insufficient evidence for sperm chromatin condensation test if the semen analysis is normal. Sperm aneuploidy test is also not recommended if the semen analysis is normal. Serum hormonal test is also not recommended if the semen analysis is normal. If the semen parameters are abnormal, then for differentiation, whether it is due to testicular cause or hypothalamus cause or obstructive cause, we can do the serum hormonal testing, but it is not recommended as a first to perform test. Then HPV testing of the semen is also not recommended, as there are studies which has shown that HPV testing in the semen, those patients who are positive for that, lead to less conception rate, but the data is insufficient and more study is required for making it as a recommendation. Microbiology testing of semen is not recommended when the semen analysis according to WHO criteria is normal, as if the patient physical examination is normal and patient do not have any symptoms of genitourinary tract infection, medical or reproductive history, do not give any indication of sign of infection, then the microbiological culture is usually not required. And also in the WHO 6th edition manual, these technique for identifying the leukocyte, that is microbiological testing, is required and only if there is indication like clinical features suggestive of any infection, and these techniques are included in the extended section of the manual. Let's discuss what are the recommendations for systemic cause of unexplained infertility. So the first one is anti-sperm antibody, which is not recommended for unexplained infertility. The celiac disease, the testing of celiac disease can be considered. Thyroid antibody or other antibody for autoimmune disorder is not recommended. Let's discuss the recommendation regarding thyroid hormone for unexplained infertility. Thyroid TSH measurement in general is required as a preconception care. That if an infertile couple came to us, then we will do a TSH hormone level as a baseline for the preconceptional evaluation. And if the TSH is within normal limit, then there is no need of additional test thyroid evaluation. This is the Eshre 2023 recommendation. Testing for thrombophilia in unexplained infertility is also not recommended, as these tests are not available globally, and also these are very expensive tests and there is no effective proof that it will cause unexplained infertility. So these are not recommended. Test for oxidative stress in semen of males should only be considered in research setting, as the evidence is limiting and it will require more research. Also, oxidative stress in females is not recommended, and this also require additional research for recommending it in a routine practice. Genetic testing or genomic testing is not recommended, as these are very expensive tests and there is no association of a specific gene with unexplained infertility. More research is to be done to evaluate the role of genetic in unexplained infertility. Vitamin D deficiency is not recommended in unexplained infertility, as there is no role of vitamin D has been found in unexplained infertility. Prolactin is not recommended in unexplained infertility, as no role has been identified, and BMI evaluation is considered as a good practice for the preconception care. So in the initial evaluation of infertile couple, we will evaluate the BMI and will ask them to healthify their lifestyle to improve the spontaneous conception. So far, we have discussed the definition of unexplained infertility according to Eshre 2023 and ASRM 2020. And also, how will we diagnose unexplained infertility, various tests which will be required to diagnose it. So, in the definition according to ASRM 2020, they have only mentioned if the patient is ovulatory, if the semen analysis is normal and the tubes, at least one tube is patent, then we call it as unexplained infertility. But in Eshre 2023, they have elaborated it well and they included normal ovarian function, fallopian tube, uterus, cervix, and pelvis with age less than 40 years with adequate coital frequency and normal testicular function, genitourinary anatomy and a normal ejaculate. So they have also mentioned which test we will do to diagnose it. For ovarian function, we'll need that the patient is ovulatory, luteal phase progesterone. For fallopian tube, hycosi or HSG. Or for uterus, where the 3D USG is superior as compared to the 2D USG. For cervix, the systemic examination is sufficient, and we do not require a PCT test for cervical evaluation. For pelvis, examination and ultrasound. And the coital frequency is described as every alternate day, but we do not have to apply a strict boundary to the coital frequency, as it will cause unnecessary stress to the patient. And the normal testicular function, genitourinary anatomy and normal ejaculate, the semen analysis will be required, and it will be according to the WHO 6th edition. Normal testicular function and genitourinary anatomy. For genitourinary anatomy, ultrasound is not required if the semen analysis is normal, and normal testicular function is not the test like sperm chromatin fragmentation, sperm DNA fragmentation, the HPV testing of the semen, and the hormonal testing are not required if the semen analysis is normal. So this is the definition and the diagnosis according to the Eshre 2023, and as compared to ASRM, they have not defined it very elaborately. So till now we have discussed the definition and diagnosis of unexplained infertility. Till now, we have discussed the definition of unexplained infertility in ASRM 2020 as well as in Eshre 2023. We also discussed the diagnosis, which all tests are recommended, which all tests are not recommended according to Eshre 2023. So these two things we have discussed, and we will discuss the treatment, which is the most important part of unexplained infertility, in the next video, and also compare how ASRM or Eshre different in their treatment of unexplained infertility. I hope you enjoyed the lecture. Thank you for listening. We will back with new lecture on unexplained infertility, in which we'll discuss the treatment of unexplained infertility, and we'll compare both the guidelines ASHRAE and ASRM and their approaches for treatment of unexplained infertility.